So thank you to everybody for your patience. My name is Stacy Cruz. I am the Strategic Programs Manager for Fear Free, and I'll be your webinar host for this evening. Thank you for joining us for Resource Guarding in Dogs, a fear-free approach, brought to you by Blue Buffalo. Presenting today will be Dr. Kenneth Martin. Just some quick housekeeping before we begin. There are two options on your Zoom control panel, a chat feature as well as a question and answer box. We will have time at the end to address questions from the audience live. So if you have a question for Dr. Martin, please use the question and answer box so I can keep track and don't lose it in the open audience chat. Dr. Kenneth Martin is presenting for us this evening. He is a diplomat of the American College of Veterinary Behaviorists and a licensed practicing veterinarian down in the state of Texas. He has been treating animal behavior disorders and training problems for more than 20 years. He is a fear-free certified elite professional and a subject matter expert for fear-free. We're so excited to have Dr. Martin with us today. So on that note, I will pass it over to you and we will go ahead and get started.
Thank you. I'm excited to be here. So I have a pretty comprehensive lecture tonight about resource guarding in dogs, a fear-free approach. And you will notice in my slides that some of my slides are pretty text heavy. And that's actually intentional because I've been teaching for, let's say, at least 15 years about animal behavior. And you have visual learners and you have auditory learners. And so I'm a visual learner. I need to see it. I want to see the information on the slide to really take it into learning. But I realize some of you are going to be auditory learners and you really want to listen. You're more of a listener than seeing it. But in reality, if you can hear it, and you can see it, you're more likely to retain that memory. So it is intentional so that we are accommodating all audiences and that you get multimodal learning here. So with that, let's go ahead and talk about resource guarding in dogs. So I'm going to start with definitions. And resource guarding can be defined as use of avoidance, threat, or aggressive behaviors when the dog is in possession of a valued resource. And usually we're going to categorize those resources as either a food-based item or a non-food-based item. And the behavior is going to happen in the presence of a person or another animal. So resource guarding can look like many different behaviors. You can see avoidance behaviors where the dog may run away with an item, or it may run towards an item, stand over that item, hover over that item. You can see body language that looks like stiffening or freezing. They may firmly grasp the item, hold on to it, not want to relinquish it, right? If it was a food-based item, you might see the dog is eating faster. They may be actually staring at the resource, or they may be avoiding eye contact with the potential threat, whether it be a person or animal. A lot of times you'll see fearful body language. The head will be lowered, the ears will be flattened, the tail will be down. But there are times where you can see the opposite behavior. Sometimes the tail will be above the top line. Sometimes you'll be piloerection. Generally, when you see piloerection, that indicates high arousal, but it also indicates an adrenaline surge. And with an adrenaline surge, usually that means that the dog is unsure about a social context or a social situation. And then it could escalate to raised lips, bared teeth, growling, barking, lunging, snapping, and or biting. So besides looking at the behavior when we think about resource guarding, it's really important that we look at the context. And resource guarding would not happen in the absence of human or animal interaction. You know, it depends on what the person does. It depends on what the animal does that's likely to elicit a resource guarding behavior. And truthfully, what that person or animal does can actually make the behavior worse, or they can make the behavior much better. So context is going to be extremely important. The other thing that's extremely important is the resource. So when we're thinking about resource guarding behavior, you want to think about, well, who is the target? Who is the potential threat that the dog is worried about relinquishing the resource to? Is it a person or is it another animal? And classically, clinically, what we see is it's another dog in the house. Sometimes it may be a cat in the house. Sometimes it may be a parrot or some other pet in the household. But classically, it's going to be a person or another animal would be the target. We want to try to differentiate food-based versus non-food-based items that are resource guarded. Food-based, pretty obvious. It's going to be edible items. So some type of food source, it could be a food bowl, whether it actually has food in it or remnants of food, it has the odor, it smells like food. It could be other bones or it could be other chews. And then non-food based aggression typically is going to be toys or objects. But resource guarding is a pretty broad category. It's not very specific, and it usually indicates just a problematic behavior. And so some dogs, the term resource guarding has been used for some dogs that will actually guard space. Sometimes it could be a place, like the dog is on the couch, and when I approach the dog on the couch, he growls over the couch, or the dog is lying on its bed. I approach the dog on its bed, and it shows fear, avoidance, threat behavior, aggressive behavior. Sometimes the behavior may be related to a person, and then sometimes the behavior may be related to other animals. But typically, because resource guarding is a broad, non-specific, problematic behavior of dogs, it can incorporate multiple different behavioral diagnoses. And when we think about a dog like guarding a place, so it has been used terminology to people call that resource guarding behavior, but it doesn't really tell me what the diagnosis may be. Oftentimes dogs that may guard a place, it could just be fear-based aggression, that the dog has a social fear and shows aggression with social approach, and it has nothing to do with the resource. Or it could be the dog is in the crate and if there's fight or flight, it can't get away and it's more likely to be defensive. And so it's more fear and avoidance, unable to show fear and avoidance, therefore goes to aggressive behavior. If the dog shows resource guarding over a person, oftentimes to me that would indicate protective aggression. And protective aggression oftentimes is a learned behavior. And then if the dog was guarding another animal, you start to think about maternal aggression. And so those would be different behavioral diagnoses. So important to realize that resource guarding is just a broad, non-specific, problematic behavior of dogs. And so we're going to differentiate that from possessive aggression. So possessive aggression is more specific, and it can be defined as aggressive behavior. And we're going to define aggressive behavior as a hard stare, growling, barking, lunging, snapping, and or biting. So really we're talking here about any threat behavior. And when you think about aggression, it's easy to think about aggression as a distance increasing signal. The dog is saying, go away, stay away, don't come any closer because it feels threatened. The behavior of possessive aggression happens just like resource guarding, when the dog is in possession of a valued resource. So the more valued the resource, the more likely the dog is to show aggression. We're going to characterize those resources as food or non-food based items, and the behavior is going to happen in the presence of a person or another animal. But you can see here we're honing in about aggression. And when you think about aggression, there's things you want to think about regarding the behavior, and you want to differentiate. So is the behavior, is the aggression actually passive aggression or active aggression? So you can think about passive aggression is a hard stare or a dirty look, almost like someone in a coffee shop staring at you, prolonged eye contact, giving you stink eye, a person giving you the finger, right? Pretty passive. As opposed, active aggression would be more like a full-blown fight. They're yelling at you, shouting at you, running over to you, approaching you, swinging at you, physical fight, physical contact. Okay, so passive or active. So on the grading of aggression, where does the behavior fall in? And obviously passive aggression is much better tolerated and has a better prognosis than active aggression. Say it results in a full-blown fight between housemates, dogs living in the household. Then we look at the behavior and we look at the body language, and we want to differentiate defensive versus offensive aggression. So when we see defensive aggression, it's going to be, you're going to see more fear-related behaviors and body language indicative of fear. With offensive aggression, you may see less body language indicative of fear. The dog is likely to be more confident, so confident body language, and that dog is more likely to run across the room and come at you with aggressive behavior rather than showing fear and avoidance. Okay, when we look at the context is going to be similar. So typically, possessive aggression is human or canine intervention. And it wouldn't happen if the person didn't potentially mess with the dog when it was eating, or try to take away resources from the dog, or if the dog potentially didn't steal items in the house or grab things off the counter or take things that supposedly he's not supposed to take, then the behavior wouldn't happen. But it usually happens when there's some confrontation with a person, right? Or there could be canine intervention, where the other dog in the household shows threat behavior, and then it's a battle of, well, who's going to maintain possession of the resource? We also, again, want to differentiate the resource. So it's a person or another animal as a target, it's food-based or it's non-food-based. And it's important to realize that food-based items are going to be the same, usually edible items, but non-food-based items, we're generally going to omit a place, a person, or another animal. because those would be different diagnostic categories. So possessive aggression can be a specific behavioral diagnosis, where for me personally, resource guarding is just an unwanted problematic behavior. And again, if the dog guarded another animal, say it had puppies, that would be maternal aggression. Totally different, totally different problem that we deal with, and much more specific as far as how we're going to address it. Or if the dog was guarding a place, that may be fear-based aggression, or it could be territorial aggression. If the behavior happened on the property, if the behavior happened in a certain location of the home, maybe the dog was territorial over that area. And so that's how we would differentiate those. So important concepts and definitions for you to understand. So let's look at prevalence. Resource guarding is a very prevalent behavior, and it's a common cause of aggression directed towards people as well as aggression directed towards other dogs. So in a case series that looked at biting, 75.6% of dogs were defined as dominant or possessive aggression or aggressive. So they're either dominant or possessive aggressive, pretty large, pretty broad category right there. In a caseload analysis of aggression towards familiar people, we had 40% of dogs growled at family members, 20% growled or snapped when owners tried to remove food or toys. So here we have 20% of dogs showed possessive aggression, 15% has actually bitten a person, and 12% left a mark or a penetrating wound. So about 20% of dogs showed possessive aggression, at least in that thesis paper. We also know that resource guarding is very prevalent in shelter dogs. A majority of the studies about possessive aggression, or resource guarding, I should say, are shelter studies. And so depending on what study you look at, anywhere from 7 to 30% of US shelter dogs display food guarding behavior. Now, they didn't differentiate other types of resource guarding, like whether it be toys or non-food based items. Most of the time, which in shelters with dogs, they do a shelter assessment, and a lot of shelters used to assess for resource guarding. Would dogs resource guard food, a food bowl, food-based items? So there's some variance there. One study looked at shelter dogs aggressive over food, and they found 11% were, and then they differentiated 22% of dogs were aggressive over a bone. So multiple different studies there, but about 7 to 30%. So we're right around in that 20% category of dogs. Well, in the shelter studies found that, and this is really important, more than half of the dogs that guarded food in the shelter do not guard food in the adopter's home. So really, shelter assessments to look for food guarding behavior aren't really that valid. They actually have a very low positive predictive value. So shelter testing generally isn't recommended. In another study, a different study that was a little bit older, they found 21% of dogs that showed food-related aggression in the shelter. Only 55% showed food-related aggression at home. So 45% of dogs showed no food bowl aggression at home. So that's almost about a little bit less than half there in that study. And then of 79% of dogs that did not show food-related aggression in the shelter, 22% did at home. You got to realize that the shelter is a very stressful environment. When dogs come to the shelter, oftentimes they have poor nutrition, they're in poor health, they may have internal intestinal parasites. It's a stressful environment. Right? They've been relinquished, they've been caught on the street. So you're going to see the worst of the worst behavior. And so it kind of can give us some indication that in the shelter, when they're really, really stressed and really, really anxious, maybe really, really hungry too as well, or have GI upset or gastrointestinal issues, you're seeing the worst of the worst behavior. But in a less stressed environment, like the home environment, you may not see that behavior at all. So it's an important consideration. The prevalence of resource guarding aggression is very common towards children. So this was a study by Alana Reisner, who looked at bite records to 111 children. And what she found that children less than 6 years of age were most commonly bitten in association with resource guarding. And then food guarding was the most common circumstance for bites to familiar children. Older children, it was usually related to territory guarding, and territory guarding was the most common reason for bites to unfamiliar children. So resource guarding, big risk for aggression towards children, That risk is greater the more children that are in the household and the younger the children. So really common problem. The other thing with resource guarding too as well is it can be predictive and is oftentimes associated with other types of aggression. So important to realize. Well, in that study, they behavioral screened 103 dogs, and common stimuli that elicited aggression were resource guarding or disciplinary measures. And that's what I typically see in clinical practice, that when most kids are bitten, it's either over a resource or it's what trying to correct the dog, punish the dog in a certain context or situation. Signalment. Well, really, signalment could be any age, any sex, any breed of dog. I'm just going to cite some studies because there's a lot of variance. Okay, so puppies prior to 5 weeks of age readily cover from adversive experiences, and they're unlikely to be permanently damaged from things that elicit fear, anxiety, or irritability. The brain isn't adult-like until about 8 weeks of age, and usually puppies don't show signs of fear until about 7 weeks of age. So by 8 weeks of age, the brain is adult-like based on electroencephalogram studies and based on multiple other behavioral studies. So learning is adult-like by that point. One study looked at an increased age of acquisition was predictive of food guarding. So pros and cons here. I guess you could get a puppy and you could start off everything right, start that puppy off right, possibly prevent food bowl aggression. Maybe if they didn't have those early experiences, you may have more potential of resource guarding behavior. One study looking at sex showed no sex differences. Another study found that males were more common than females and neutered males were overrepresented. And then another study showed that spayed females were more likely than intact females, and intact males were about equal to neutered males. So I really, clinically, I don't see a sex difference, males and females. I see it at any age. And when we look at breeds, most of those studies were shelter studies. And so they found mixed breed dogs were more common than pure breeds, but that may be demographic bias in that you see more mixed breed dogs in the shelter than you see purebred. Another study looked at small and large breeds were more common to show resource guarding than medium-sized dogs. And then another couple studies found that small dogs were overrepresented for resource guarding, biting, and aggression towards people. So you can think those small, little, snappy, irritable dogs. When you think about dogs and selection for dogs, a lot of times smaller dogs are more selected for companionship and less selected for temperament. Obviously, if a large dog had a temperament-related problem, it's more likely to be euthanized than if it was a Chihuahua. And that's speaking from someone who grew up with long-haired Chihuahuas. Like our little long-haired Chihuahuas showed a lot of aggression issues. And it was in the day where litigation wasn't very common, and it was just kind of lots of our little dogs bit people, and we didn't do anything about it. So you have more flexibility. Like little dogs cause more damage than large breed dogs, and I know aggression was a huge problem in the Great Dane, and they selected against that and really have changed the breed because you can't tolerate it in such a large breed dog. All right, let's talk about history. And with history, we're looking at the ABCs. And the ABCs stand for the antecedent, that what leads up to the behavior. You actually have the behavior, and then you have the consequence of the behavior. So a lot of times with behavior and asking histories and behavioral questions, we think about the what, the when, the where, the who, the how. Okay, we tend to focus on the behavior, but you got to realize that behavior is only 1/3 of the information that you need. The antecedent's the other third, the consequence is the other third. So you have to ask, what is or are the problematic behaviors? And really, you don't want to lead the client to give you information. You want to say, what does that behavior look like? So there you're really focusing on the behavior. And when we say what it looks like, you're really looking at what is the body language? What is the body language of the pet when it shows resource guarding behavior? The when and the where of the behavior, okay? When and where. So sometimes the aggression, possessive aggression or resource guarding behavior may be more likely to happen in a specific area of the house. Maybe it's when the dog is in its crate. Maybe it's when the dog is on the couch. Maybe it's when food has fallen on the floor in the kitchen when you're cutting up vegetables and cooking. So where does it happen is going to be important. And then when we think about the when and the where, we may get information about the resource, because really the resource is the antecedent that induces the behavior. And so if we can control the antecedent and we can avoid the antecedent, the trigger, then we can avoid the behavior from happening. You want to know who is present or who is absent when the behavior occurs. So obviously the behavior of the dog or the behavior of the person, how do the people or how do the dogs react to the dog's behavior? That's going to be important. And with that, we're identifying the target. So the target can be the antecedent. That person approached the dog when eating, but the target can also be the consequence, right? And you may have a person approach a dog when eating, the dog growled, the owner reprimanded the dog, tried to correct the dog, then the dog bit the owner. So it really was, you're really setting up another ABC consequence where the dog growled, it was reprimanded, so the reprimand becomes the new antecedent, and then the bite was the next behavior. So it ends up being a whole nother circle there, okay? When and what has been done to treat the behavior. So we want to know how the behavior was treated, were previous behavioral modification techniques or training techniques, were they successful? And it's really important to identify if aversive-based techniques were used, because the longer the learning history of negative associations and the use of positive punishment, we'll get to that, the more likely you're going to have aggression issues. So it's going to escalate from fear and avoidance to more serious aggression. And then we ask about how did the behavior progress? So I want to know, has the behavior been the same since puppyhood if it started when it was a puppy? Has the behavior gotten worse or has it gotten better, especially with what treatments have been implemented? Okay, causes. So a lot of times when we think about causes, we think about, is the behavior normal or abnormal? And to really consider that, you have to say, well, is the behavior normal for the species? Here we're talking about canids. Is it normal for the breed? You really want to know about breed-specific behavior. Is it normal for the age of dogs? And is it normal for the previous learning history? What I will say is that resource guarding behaviors can be normal behaviors of dogs. Most dogs will show avoidance behaviors. Most dogs will show subtle conflict behaviors. You could think about those as signs of fear, anxiety, and stress. They may show rapid ingestion if they're in the presence of a food source, an edible item. And it's pretty common that dogs will be competitive with other dogs. And so you can see intraspecific aggression or dog-dog aggression if food and resources aren't managed in multi-dog households. But what determines if it's normal or abnormal really depends on the history and the context. So if the animal had a history of malnutrition, it was malnourished, it's starving, well, then it's more likely to guard resources, especially food-based resources. If the dog had stress or chronic illness, it wasn't feeling well, stress is going to lower the fuse of tolerance. It's going to make the animal more irritable and more likely to escalate to aggression. We want to think about certain medications that were used because prednisone as an appetite stimulant may make actually food more valuable and make dogs who never guarded food now start to guard food. And it also has psychotropic effects. So it can increase irritability, increase anxiety, it can increase frustration too as well. So we think about certain medications. And it's not just appetite stimulant medications that may contribute to resource guarding behavior, but it's also medications that potentially could cause GI upset. And make the stomach upset or possibly induce nausea. You may see that, so it's important to realize that. Is there social competition over food or toys in the home? So and was there a lot of social competition? Was it a large litter where they really had to compete for that teat or that nipple to get food? Or was there a lot of competition for food, or was food limited at an early age? Because with children who have had limited food at an early age, they're more likely to hoard food even when they have a lot of it and it's not limited later on in life. So what is the behavior of other housemates, other dogs in the environment? You want to think, was the dog threatened or teased over resources? And sometimes there can be inappropriate management or training techniques or the use of positive punishment, and that contributes to the behavior. For example, I've had clients tell me, well, when he was a puppy, I messed with him while he was eating. I reached my hand in his food bowl. I would give him his food bowl and I would take his food bowl away from him. And the analogy I'd give you is if you went to a really fine restaurant and the waiter would come over to your table and he'd take your plate away, but he'd give it right back to you. He'd take it away, but he'd give it right back to you. What are you going to do the next time that waiter comes over to your table? You're going to hover over it, right? You're going to give him a look and stink eye like, I'm not done. Don't take away my food. So there's going to be a negative association with that. And that's going to make the behavior worse. So inappropriate management, positive punishment-based techniques to try to correct the behavior are actually going to make the behavior much, much worse. And so more importantly than looking at is the behavior normal or abnormal, it's probably a better question to say, is the behavior undesirable or is the behavior problematic for the owner? If it is problematic for the owner, we're going to try to address it. But then again, is it normal for the learning history? Because with the history and context that we described, well, certainly that behavior would be normal. That dog had a traumatic upbringing, right? Or has had previous past traumatic experiences. So it would be normal, but still undesirable and problematic and a potential for risk and injury. All right, risk factors. So genetics and learning come into play, and it's half of nature and it's half of nurture, really. But a couple studies looked at temperamental traits, and they found that fearfulness was associated with resource guarding in dogs. And in general, fearfulness and fear is probably the #1 cause of aggression towards multiple different targets. In same study, they found that impulsivity was associated with avoidance, rapid ingestion of food, and resource guarding aggression. So you can think about impulsivity as if you have a Newfoundland, you're in the kitchen, it's a small kitchen, you drop some food on the floor, and the Newfoundland just stands there and waits for you to step out of the way and casually walks over and eats the food. That dog wouldn't be impulsive. But the Newfoundland that barrels past you, knocks you over, scarfs down the food right away, that dog doesn't have has impulsivity issues. Or the dog that can't sit and wait for its food bowl when the food is offered to the dog that just dives in, scarfs it down really quickly, can't wait. Those are impulsivity issues. So impulsivity issues can be associated with resource guarding behavior in dogs. So here's a study that didn't really look at resource guarding behavior in general, but they did look at significant risk factors for biting. It's a pretty old study, about 20 years now. But it pretty much hones in the actual causes of resource guarding behavior in dogs. And what they found in that study as risk factors, small if female, pruritic or malodorous skin conditions that received veterinary treatment, one or more teenagers in the home, and when kids are in the home, it's a more unpredictable environment. And if the dog exhibited fear of children, men, or strangers. And interestingly, during the first 2 months of ownership, if the dog showed aggression over food, that was a risk factor for future biting. So we know aggression over food is a risk factor for aggression in other contexts. They're unlikely to grow out of it if you see it in a puppy. And so we want to try to address it pretty quickly. The other thing they found that within the first 2 months of ownership was excitability. And if you see excessive mouthy behavior in puppies that are abnormal, they're unable to settle, they're just really, really excitable and show mouthy behaviors, those dogs are more likely to show aggression towards family members and other contexts. And a lot of times it's because the mouthy behavior gets punished and it puts the animal in a motivational conflict. And then also they found that sleeping in the person's bed during the first 2 months was associated with it. And again, this doesn't tell us cause and effect, but it does give us an indication of associations. So let's talk about prevention. So one thing is provide good nutrition and good health. You want to make sure the animal is healthy, it's not sick, it's not under the weather. We can prevent behavioral problems by addressing good health and good nutrition. Make sure the animal is not malnourished, that it's getting a balanced diet. We want to avoid social competition between conspecifics. So we want to have good management in multi-dog households, or management of the toddler, so the toddler isn't wandering over to the dog and reaching in the food bowl when that puppy is eating or adult dog is eating. We want to avoid inappropriate management and training techniques and positive punishment. So in one study, these factors were significantly associated with resource guarding behavior, was taking away toys, bones, or other high valued objects, taking away food from the dog, and retrieving items or food that were taken by the dog. So maybe the dog stole items and you're like, no, give me that back. You can't have that. Those were risk factors associated with resource guarding behavior. Another behavior that was significantly associated with resource guarding behavior and increased the likelihood of more severe and more frequent resource guarding behavior was taking the food dish away during mealtime. So just taking it away and giving it back, taking it away and giving it back. You're actually creating more problems than you're actually solving. That's not the way to do it. Prevention, you might think about engaging the dog in appropriate and interactive play. So a big myth is never play tug of war with your puppy. Here we're talking about prevention. We're not talking about dogs that show resource guarding behavior. We're not talking about dogs that show aggression, but appropriate play and tug of war and not letting the dog win. So it's really important that we let the dog win the resource or win the toy, because if they don't win the toy, they're never going to want to bring it to you because you always take it away. And if in all the bite sports that I've competed with and worked with police dogs and sport dogs, a big component of training that is letting the dog win the object and then run over and play with their handler with the object. So those are really important concepts that we want to do. Teach your puppy to bring the object to you. Teach the puppy that you're going to exchange and give it something else is going to be important. So let's talk about prevention exercises. With these prevention exercises, it's important to realize we're talking about dogs that don't show significant resource guarding behavior. They may show avoidance behavior, but they're not actually showing aggression. Some of these prevention exercises could actually be dangerous if that puppy or that adult dog was showing aggression. So one study looked at adding palatable bits to food during mealtime, and they found that it was significantly associated with the increased likelihood of less severe resource guarding aggression. So I'm going to show you a video of our new little puppy, Chip. He was about 5 months old, and we're going to be adding palatable bits of food during mealtime. So here the puppy is learning that hands reaching into the food bowl equals something better, something really palatable, something really desirable. And so there's a positive emotional response with reaching to the food bowl or human presence near the food bowl. Another prevention exercise, offering palatable bits of food to the dog with an item. So when it has an item, rather than taking that item away, you go and you give the dog something better and you don't take the item away. So human approach means something better falls from the sky. Or if you are going to take something away from the item, or from the dog, I should say, an item away from the dog, you always want to do an exchange. And that exchange is going to be in the dog's favor. So the analogy I use with people, I say, if I asked you to give me $20 and I said, I will give you $50 in return, your emotional response would be, I'll do this all day long. Here's 20, give me a 50. Here's 20, give me a 50. And that's the emotional response you want in your puppy or your adult dog. Here's Chippy, he's chewing on a water bottle.
What do you have?
She took the paper away, she left him with the plastic water bottle. She walks over to him again, doesn't take the object away, offers him a food treat. So we're creating a positive association when you have objects. People don't always take those things away. Another analogy I use is that people should be the giver of good things rather than the taker. Sometimes we'll use a counting game. An accounting game was essentially pioneered by a positive reinforcement trainer, Sharat Patel. And it can be used for managing, preventing negative associations with removing the resource. So if the dog had a resource, you may walk over away from the dog, count treats out on the floor, 1, 2, 3, 4, and the dog will likely learn to leave that resource and come over and eat the food that you're putting on the ground. As soon as the dog approaches the handler, approaches the trainer, you want to walk away and you do the counting game again. So let's watch Debbie doing this exercise with Chip.
One, two, 1, 2, 1, 2, 3, 1, 2, 3.
So let me say that's a prevention exercise. You wouldn't do that exercise with a dog that resource guarded food, because obviously putting food down on the ground, the dog may not eat that resource and may guard that resource. Other prevention exercises, a drop it or leave it cue. In one study, it was significantly associated with a reduced likelihood of resource guarding avoidance and resource guarding aggression. So here we're going to watch Debbie with Chip basically teaching a leave it cue. Basically, leave it means don't put your mouth on it. We're just rewarding the dog for ignoring the item that drops on the floor. And she's going to drop the item on the floor, and then she's going to give the cue leave it. That's because typically you're going to drop something on the floor by accident, and you want that to be the cue. So we're just rewarding non-interest in the resource. It's a Sharpie pen here.
Leave it. Leave it.
At some point, you got to work through different value of items. You got to rotate. You want generalization to happen. And you want it to happen outside of training context too as well. So
Leave it.
you have to work on generalization for this to work. Okay. And then we can teach a get it cue or a bring it cue. So I'm going to show you a video about this where we're working on some impulse control. She asks Chip to sit down, and then she tells Chip to get it. So he's waiting to be cued to get the item. Getting the item means put the item in its mouth. And then bringing the item is bringing the item to the handler. And then you will see she does an exchange when she asks for a drop, which she calls out, is the cue that she's using in this video.
Sit. Get it. Yeah. Get it. Oh, you get it. Bring. Oh, what a good pup. What a good pup.
So Chip was taught to bring items to your hand. Very important, whenever you take something from your dog, even if it's something that they wouldn't guard, you do an exchange.
Super pup.
So you want your dog to bring items to you and learn to play with you with those items. Okay, a hand target. A hand target can be a recall, but a hand target also could be beneficial because the dog then thinks a hand reaching for them is just an operant response of touch your nose to the hand. So let's watch how this is taught. So we're using a clicker to mark the behavior. Nose touches the hand, click, followed by food treat. The hand is actually the cue. It precedes the verbal cue. So it's going to be eventually be on the hand presentation alone. Okay. And then lastly, we think about food bowl prevention exercises. This is thinking about preventing food bowl aggression. And so what we do with this exercise is that we are going to present the dog with 3 kibbles in the bowl. So we present a food bowl that actually has food in it. We wait for the dog to consume that food, and we take away an empty bowl. We add 3 more kibbles to it, present the puppy with food in it, give the puppy time to eat. Eventually, with the prevention exercise, we may add food to the bowl while the puppy was eating. So there's a classically conditioned emotion response that hand near the food bowl equals more food is going to be added to the bowl. Okay, let's move on to clinical signs. So our clinical signs really manifest depending on the dog's appetite. That's going to influence the behavior, the stress or the emotional state of the dog at the time, and the previous learning history. And so the 3 clinical signs that you typically are going to see are going to be aggression, either rapid ingestion of edible items, and they're going to be preceded by signs of fear, anxiety, and stress or conflict behaviors. And then lastly, avoidance behaviors, sometimes you'll see. You have to realize that most of these cases are not related to dominance. It's really a social fear, or the dog has a fear of relinquishment. Most of these dogs are fearful. And so you can have social fear. That social fear, especially if people have been confrontational with the dog, can escalate to social aggression. And then there can be a fear of relinquishment, because when the dog has these items, people go and they take it away. And so fear can manifest as the 4 Fs of fight, flight, fret, or fidget. Your clinical signs are going to acutely follow the antecedent. So the dog is near or in possession of a resource which it considers valuable, and you can't decide, what is valuable to the dog or what is not valuable. Sometimes they have their own preferences. And then it's going to be a person or an animal approaching the dog. So the behavior would not happen without those 2 factors. The antecedents associated with resource guarding are often identifiable. Rarely you may identify the antecedent after the consequence of the behavior. For example, I approached the dog lying down on his bed. He was aggressive to me. He growled at me. He bit me. And then I realized he had a bone underneath the covers, or he had a napkin that he was laying on top that I didn't realize he had that resource. And the really tough cases of resource guarding that show aggression are those where they're very indiscriminate, or we can't control access to the resources that are guarded. The presence and/or absence of stimuli are going to be important for identifying associations. They're going to be important for determining the diagnosis, and they're going to be important for implementing appropriate behavioral treatment. So with resource guarding avoidance, essentially it's a manifestation of social fear. And these may be opportunistically acquired items, like the dog steals some food off of the counter, or the dog steals a napkin or a dishcloth off the counter. And runs away with it. Ileana, my own dog, my Malinois, who just passed away recently, she would steal face cloths off the counter, dish towels off the counter. She would actually go and grab dish towels out of the cupboard if we had the cupboard open. But I taught her to bring those items to me. I would say thank you and put the items back away. So she taught me to keep doors closed, keep the counters clean. She taught me a lot of good life skills. But it's the lesser evil. I wasn't confrontational with her. When she was a puppy, she used to go and grab magnolia pods, big giant magnolia pods. We had huge magnolia trees in the backyard, and she'd pick up these pods in her mouth, and I was worried about her eating them. And so I would always go and grab those pods out of her mouth when she was a little baby. And I actually realized that, hey, I'm creating a problem. Look, now she's showing avoidance behavior when she has an item, because I would just go walk over and take that item out of her mouth without doing an exchange. So we learned that was 14 years ago. Sometimes you don't think about how your behavior is influencing the dog's behavior, and how we need to change that to change the learning history so that we're not creating problems. But sometimes with avoidance behavior, the dog will run away with an object or refuse to relinquish it. They may place their mouth or body on or in between the object or the approaching person or animal. And in the really severe cases of avoidance behavior, you may actually have ingestive behavior. A lot of times clinically, these are the Labradors that pick up a rock or pick up pantyhose or some clothes in the house, and people have been confrontational when the dog steals that item. And so instead of relinquishing the item, the dog swallows it. Let's see a video example of resource guarding avoidance with Chip. So this was a stalk of asparagus that actually fell on the floor. This is what not to do, but I wanted to show you a video example of what avoidance behavior may look like.
What you got, Chippy? What is it, Chippy?
So this shows that this is a normal behavior, and Chip was worried that I was going to take the item away. So we want to change the associations there. Other clinical signs: rapid ingestion of food or edible items. That's going to be preceded by fear, anxiety, or stress, appeasement behaviors, conflict behaviors with social interaction. So here we have a modified ladder of aggression from the British Small Animal Veterinary Association. And so you see subtle signs of conflict: yawning, nose licking, lip licking, turn their head away, turn their body away. Walking away. I really like this picture of walking away because the dog has a resource in its mouth, like almost like a sock or a piece of cloth. Cowering, ears back, standing, crouch, tucked tail, lying down, leg up, stiffening, staring, and then rapid ingestion generally would follow. And then the other clinical sign would be resource guardian aggression. In one study, it was more common with rawhides, followed by food or other edible items. Aggression may be defined as snarling, growling, barking, lunging, snapping, or biting, threat behavior. So here we have the ladder of aggression from the BSAVA. Most people think about aggression as growling, biting, or snapping. That's really the top of the ladder. It's important to realize that body language showing fear, anxiety, and stress are precursors to aggression. And if we can identify those precursors and we can have owners identify those body language, we can prevent people from being growled at, snapped at, or bitten. When we look at aggression, we're going to characterize offensive versus defensive body language. We're going to look at, is the aggression active versus passive? We want to identify the target of aggression, and we want to identify bite levels. So let's show you a video example of resource guardian aggression. These are really, really old videos back, I think, when they weren't even digital. They were VHS. I don't even think we had smartphones back then. So it was during my residency at Purdue University. So these are little dachshunds showing some different presentations. So bear with me, it's an old video.
No, it's not yours. Food guarding, huh? You about done, Ian? You about done eating?
Of course, these are all things not to do, not very fear-free. This little guy would show a resource guardian in his crate. And here we have a Rottweiler and the complaint was when I interacted with him when he was eating, he would freeze and growl at me. You can see he kind of freezes. He's really slow at eating. He's not a more rapid eater. It's actually the opposite of clinically what sometimes you see. He can't really hear the growling, but the owner insisted on petting the dog while it's eating. Okay, medical diagnostics. So you want to rule out that there isn't a medical problem contributing to the behavior. Your physical exam should be normal. More important to look at a physical exam when we have aggressive behavior, because you want to rule out potential causes of aggressive behavior. A mild fear, social fear, mild social anxiety, avoidance behavior. Yeah, it's important to rule out that those animals don't have medical factors that we could treat, because medical factors also influence behavior. Generally, we're going to recommend a brief neurologic exam, looking at cranial nerves, muscle symmetry, gait, CP deficits, perianal reflexes. You want to try to get an idea, could this animal have megaesophagus? Could it have myasthenia gravis? Does it have sensory perception abnormalities, which could contribute to changes in behavior? We may consider blood work, CBC, serum chemistry, urinalysis for completeness. Nice to know that the animal is healthy, nice to have a baseline, especially if we're going to consider using behavioral medications. And we're more likely to consider behavioral medications in significant cases of social fear and avoidance or cases of aggression. Plus or minus fecal screening, yes, intestinal parasites can cause GI upset, and GI upset can lead to resource guardian behavior. And then plus or minus a thyroid profile, because thyroid abnormalities could be associated with aggression. Medical differentials, really any medical disease could cause a change in behavior. So it's really important that you review the medical history in the patient and you look for different conditions that could influence aggressive behavior. You look for medical conditions that can influence the gastrointestinal tract, like a sensitive stomach, food allergies. Usually those things indicate that the dog has some underlying anxiety or stress too as well. So it's not just necessarily a medical problem, there can be a behavioral problem, and we're gonna have best success if we treat both. And then conditions that influence appetite. You also want to identify, have any concurrent medication, supplements, or alternative therapies been used that have influenced appetite or palatability of food. So I did have one case, behavioral case, that the dog had aggression for multiple other reasons, but when they used a probiotic supplement, they added that to the food, which was very palatable. They saw a food bowl aggression. So adding something palatable to the food may actually increase food bowl aggression. And then certain medications that influence the GI tract or influence appetite may also influence aggression too as well. Metabolic and endocrine diseases could cause it. So thyroid disease, diabetes, especially alterations in blood glucose associated with eating, adrenal diseases, and of course there could be a pituitary tumor too as well, or a pituitary as a primary cause for Cushing's disease or hypoadrenocorticism. You want to look at pain-related conditions. So does the dog have dental or oropharyngeal disease? Obviously, this dog has retained decidual teeth. It has some gingivitis likely too as well. And you could think about, hey, I'm hungry, but I have a toothache. And so I'm starving, you know, or you may have a toothache that's sensitive to cold or sensitive to heat. So you're starving, you drink some water, you eat something, you take a bite into it, and you're like, ow. Extreme pain, it hurts. That could make you really frustrated and anxious about eating. And it's going to lower your fuse of tolerance. And then musculoskeletal disease. So this may contribute to dogs who have a resource but don't want to get up and move away because they're uncomfortable about getting up and moving away. So they may be more likely to guard it. And in a lot of studies, pain is associated with behavioral problems. So we always think about treating pain-related conditions when we address behavioral problems. So our behavioral differentials. Probably the number one common comorbid diagnosis that we have with possessive aggression would be conflict-related aggression. With conflict-related aggression, the dog is in a motivational conflict. It wants to approach its owners. It's generally aggression directed towards family members. And at some point during the social interaction, the dog becomes uncomfortable. And rather than showing fear or avoidance, it stays there and it shows aggression. With fear-based aggression or fear-related aggression, typically the owner interacts with the dog and it has nothing to do with the resource. Sometimes there can be hyperactivity. Hyperactivity can be a breed-specific behavior. You think about certain breeds that are more excitable, and hyperexcitability, when dogs aren't getting enough mental stimulation, they may be more likely to steal items, steal resources, run away with those resources. And, you know, like my Malinois, essentially, and she had lots of mental stimulation, but, you know, she found that was an attention-seeking behavior, and it's attention-seeking behavior that worked. Or there could be hyperkinesis, and hyperkinesis is rare in dogs, but it basically mimics attention deficit hyperactivity disorder in people. There can be excessive attention-seeking behaviors. When you usually see excessive attention-seeking behaviors, it may be an indication that the dog has underlying generalized anxiety, a high level of internal arousal, and they find ways to get their people to look at them, talk to them, pet them. And it doesn't matter if you fuss at the dog or you're like, hey, what you got, buddy? I love you. Either way, you're reinforcing the undesirable behavior. Could be associated with separation anxiety, especially some cases of separation anxiety have hyperattachment. So they show behaviors in the owner's presence and excessive attention-seeking behaviors. And again, most of these attention-seeking behaviors end up being conditioned. And then other differentials would be intraspecific aggression, so dog-dog aggression in the home associated with possessive aggression. Of course, there can be multiple other motivations for dog-dog aggression, or interspecific aggression, where the dog was aggressive to the cat over resources or aggressive to other species. And there can be multiple different causes and motivations for that behavior too as well, such as predatory behavior. So our behavioral diagnosis is going to be based on the clinical signs, the dog's motivation, the antecedent for the behavior, and the context or the situation. So when we're looking at possessive aggression, it's the most common presentation that I see in my practice of resource guarding. We're going to identify, is it a food or non-food based item? We're going to say, what is the target? Typically it's going to be a person or it's going to be another dog in the household. And what was the severity of aggression? Active, passive, offensive, defensive. So let me give you some examples. Diagnosis may be possessive aggression towards humans. Food bowl, the dog was offensive, so it means he likely ran away from his food bowl across the room, maybe chased the person outside the room, and the aggression resulted in a significant level 4 bite. So we may use Ian Dunbar's bite scale, and so that's a pretty significant bite. Multiple bites would be a level 4. It could be possessive aggression towards humans where it's only novel toys. Old toys the dog doesn't guard, but novel toys the dog does. Maybe more defensive, so we may just have growling only, and actually have a lot less risk of injury. And the more frequent that aggression is, if it's happening day in and day out, it's actually much more treatable, and you can assess, are we making progress or not, as opposed to if the aggression is really infrequent. So treatment, medical. First, we treat the patient's physical health, and then we treat the patient's mental health. So we're going to look at dental and oropharyngeal health. So can we give the animal a dental? Can we look for dental pain? We're going to consider gastrointestinal health. Oftentimes I'm going to consider probiotics if the dog has a sensitive stomach or underlying anxiety. And then we're going to consider musculoskeletal treatment. So multimodal pain management, I almost always consider in all my patients. So address the medical health first, and then think about addressing the behavioral health. If you miss one, you don't treat one, you're not going to have very good success because mental health and physical health are inseparable. When we think about dietary modification, ideally feed the dog a complete and balanced diet based on its health, life stage, and breed size. You also want to consider the palatability of the diet being fed. This isn't what you're recommending, but it's what the client is doing at home. Are they feeding dry, wet food, raw food? Obviously, the higher the value of the food, like raw food, is more likely to result in resource guarding than a dry kibble. And so you want to think about how that can influence resource guarding behavior. We're going to avoid access to long-lasting resources that may be guarded. So we're not going to give the dog bones, rawhides, pig ears, bully sticks, take all those things away for right now. So we're trying to avoid antecedents. Don't give it food puzzle toys, and avoid ad-lib feeding where the food bowl is down all day long for dogs that have shown resource guarding over food. And then we want to assess the dog's fear-free treat ladder. So we paired with Blue Buffalo. There's a Blue Buffalo fear-free treat ladder handout that's going to be coming out pretty soon. And it's going to be for assessing the treat ladder in the veterinary hospital. And the reason for that is that dogs have preferences. And we're going to want to use food for classical counter conditioning, where we're changing a negative emotion to a positive emotion state by adding food, or classical conditioning, a neutral emotional state to a positive emotional state. So we want to know, is the animal hungry? Does he take treats? And if he isn't hungry and doesn't take treats, we need to think about gastrointestinal reasons, or sometimes, well, in rare cases, we may think about appetite stimulants, but there is risk with that. All right, dietary modification again. So general recommendations would be manage the dog's access to food or the food bowl in the home. We're going to feed the dog twice a day and a set schedule rather than ad lib. When we looked at Purdue University's caseload of behavioral problems, regardless of what the diagnosis was, when we switched from ad lib feeding to feeding twice a day, we had an improved outcome. So it wasn't a cause and effect, but it was an association. And so that is a recommendation. We're going to feed the dog twice a day on a set schedule. We prepare the food in advance. We don't have the dog underfoot, so that he's likely to guard that. We feed in a low traffic area away from other pets or people. So this is just management. We're going to isolate the dog and ignore the dog when eating. Let's not mess with them. Let's not reach your hand in the food bowl or try to elicit aggression. And then we're going to remove the food bowl when the dog is not underfoot. So people are viewed as the giver of good things and not the taker. Sometimes dietary modification would be behavioral modification for food bowl aggression. And we'll talk about that later, and I'll show you a video. Okay, activity. So general behavioral problems, we're going to recommend walking the dog twice a day off the property. Mental stimulation, moderate exercise can reduce stress and boost serotonin levels. You want to evaluate the safety of this recommendation. This is not an appropriate recommendation for all dogs. Some dogs are fearful or anxious on walks. Some dogs are reactive on walks. Some owners aren't able to control their dogs and keep the public safe. So you have to evaluate the presence of other behavioral problems before making that recommendation. And a lot of times environmental enrichment is something that we recommend for dogs that have anxiety related problems, but not in cases of resource guarding. So access to toys may need to be taken away right now. We avoid that. We avoid that antecedent. We don't want to chase the dog when it has an item in its mouth as a form of play. I don't ever want to encourage a dog, puppy, adult dog, to play keep away. I want the dog to think, if you have an object in its mouth, bring it to its handler, bring it to its person, and you're going to get something good in return. Like you would think about a service dog, right? Pick that object up for me, bring it to me, help me out here. And then teaching tug or fetch, where the owner always wins, that can be problematic. You know, those were old recommendations. Make sure you're the dominant person. Make sure you always win, that, you know, you have control of the item, but it actually creates problems. Yet if you have items that the dog doesn't guard, then we're always going to do an exchange. So usually we have two identical toys. You trade one toy for another toy, or we say, swap me the toy, the tennis ball, something that he's never guarded. He's pretty comfortable about me taking away. But just because you can take it away, don't do you want to make sure you do an exchange. So always give a food treat. So environmental modification, the goal of modification is to decrease fear, anxiety, and stress in the patient. But sometimes some of the recommendations we have to make might, especially if there's other comorbid diagnoses like separation anxiety. So with environmental mod, you're going to use antecedent arrangements. We're preventing the practice of undesirable behavior and the consolidation of negative memories associated with it. So can we identify what are the antecedents, and can we either avoid, alter, or lessen the value of stimuli that induces resource guarding? So this may be actually changing the diet, right? Or thinking about the dog's hierarchy, like these things are really valuable. Let's avoid giving those things. And then we're going to manage human-dog interactions and dog-dog interactions. Those may need to change where they're separated, okay? We have a new feeding routine. Maybe the dogs are separated with meals, so we don't have resource guarding aggression between the dogs. We're going to safely manage the dog's exposure to resources when possible to prevent negative associations. If we can't stop the behavior from happening day in and day out, we're not going to have progress. So what I tell clients is that you need to control the learning environment by either preventing the practice of undesirable behavior, or you need to be working on positive controlled exposure through specific training or specific behavior modification exercises. Some of that management may be baby gates, exercise pens, supervised tethering, or confinement away from obtainable resources or problematic areas of the home where food may fall on the floor, like at the kitchen table, something like that in the kitchen. And there are other times environmental modification or the animal's ability to interact with the environment, we may change by considering basket muzzles. And basket muzzles oftentimes are going to be recommended if we can't avoid, say the dog may pick up a chicken bone on a walk, and you don't always know when there might be a chicken bone there, and he's really aggressive and there's the risk of him swallowing the chicken bone, right, and having a perforation. Then a basket muzzle would be recommended. And in cases of aggression, a basket muzzle may be recommended too as well. Lastly, we're going to avoid contexts and situations with induced resource guarding or fear of relinquishment, because exposure, repeated exposure, may actually set the dog up to fail to habituate and may actually worsen the behavior. And so when we do need to make environmental modification recommendations and we're concerned like, well, my dog's going to be really stressed if I take away all his toys, he's not going to have anything to entertain himself, right? To dissipate some of his maybe internal arousal or anxiety. Then we consider behavioral medications and or supplements to help the dog to cope with that environmental modification. So medications can be extremely helpful to reduce fear, anxiety, and stress and have success with the patient. And then sometimes we think about complementary alternative therapies, and those may be calming pheromones for promoting relaxation. Next, we think about addressing and enhancing the human-animal bond. So we're going to look at human-dog social interactions, and we're going to try to give the dog a routine of set by humans, feeding the dog twice a day, walking the dog twice a day, scheduled play sessions on a set schedule where it's the owner's terms and not when the dog demands it, and then structured training and behavioral modification sessions. When you have dogs that show resource guarding avoidance or dogs that show resource guarding aggression towards people, we want to modify human body language and social interactions so they're not eliciting threat or social pressure in the dog. They're not eliciting social fear and avoidance. So avoiding eye contact, looking away, turn sideways, essentially a fear-free approach to our social interaction. So we're not inducing social pressure. We're generally going to recommend all human-dog social interactions that are associated with food. We may feed the dog little food out of a food bowl, and it gets its kibble, it gets its food from human-dog interactions. And then if the dog can respond to known cues, we'll structure those human-dog interactions in the format of a cue response reward. If there's resource guarding associated with excessive attention-seeking behaviors, well, ideally we modify the environment to prevent the stealing of items. We may ignore the dog if it's a low-valued item, like he steals a Kleenex. He can eat the Kleenex. It's not going to hurt him. I'm not going to call attention to it to possibly reinforce the undesirable behavior. But generally, we're going to interact in a cue response reward format, and we're going to teach the dog alternate appropriate attention-seeking behaviors that work. So reward other incompatible behaviors on a high rate of frequency. So sitting calmly and staring at you makes you look at it, talk to it, pet it. Other attention-seeking behaviors like stealing objects, running away, chewing on things, right? Stealing the laundry, don't get reinforced. And we manage it so we decrease the frequency of the behavior. With enhancing the human bond, we can't use any punishment, verbal or physical reprimands. We know that contributes to fear, anxiety, and stress. It damages the human bond. You can't control the associations. You fuss at this puppy with this little girl there right by it. The dog may associate the punishment with the little girl and be more likely to be fearful and aggressive. So it can make the behavior worse. And our alternative to punishment is response substitution. It's a 3-step process: interrupt, redirect, reward. You think, I don't like my dog doing blank behavior. What do I want them to do instead? We're going to think about training for the specific situations. Training is important for response substitution. It's predictable owner-dog interactions. It's important for behavioral modification in a variety of contexts. And essentially, training can foster a fluent language and help with trust and confidence with our social interactions. But our training has to be positive reinforcement based. If you're using adversives, prong collars, shock collars, choke collars, verbal reprimands, it's not building trust. It's making the dog more fearful. So we're usually going to use a clicker or verbal marker. We're going to use food for primary reinforcement. And ideally, we have about 10 minutes a day we're focusing on training. The things that I work on are a leave, a drop, a get, a bring, a hand target, a sit, a come, or a place. It's helpful as veterinarians to give recommendations where they can find good information. And a book that I use with all of my clients, a book that I wrote with my wife, Debbie Martin, is Puppy Start Right. And it's a book that we use with puppies, adolescent dogs, as well as senior and adult dogs. All those training exercises are in there using positive reinforcement, and it talks about clicker or marker training. So we can use these trainings so we have a fluent language and can get the dog out of a certain context or situation without being confrontational. And then let's talk about behavioral modification. So systematic desensitization is the gradual controlled approach to a stimulus in such a gradient format that it doesn't elicit fear, anxiety, stress, or aggression. One could be an approach exercise where you approach the dog from a distance that doesn't elicit aggression and toss a food treat and walk away. Gradually, you can get closer and closer to the dog, maybe eating out of its food bowl, in mild cases of food bowl aggression. And the dog associates human approach means food treats rain from the sky. I like people walking up to me when I'm eating. It means I'm going to get something better than my regular kibble. The other is relinquishment exercises. And so we're going to show a video. This is Debbie years ago with one of my dogs, Ellie. It's a controlled exercise. The dog is tethered to a stable point. You work at a threshold outside of the dog's tether point so that's safe, especially if you had a dog that showed aggression. And you look at a preference hierarchy for what resources a dog is likely to guard. Essentially, it's a give or a leave it. Don't put your mouth on it. We start with an object that the dog doesn't even want to guard and reward not showing any interest in the object. This video is not perfect. You'll see Debbie working within the threshold of the leash. If the dog was aggressive, it potentially could be dangerous. Debbie's leaning over. And so if we were concerned about it, we could use a grabber like I have pictured up here. So you don't have to bend over. You can reach and grab, and it's an extension of your hand.
Ellie. Yes? Girl. Yes? 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 Girl. Yes? Good girl.
Important with systematic desensitization is that we keep the dog successful. And so initially when we offer the object, there may be times where we offer the object out of the dog's reach. So it can't put its mouth on it, and we just reward the dog for not showing interest in it. So here we have a stuffed toy, maybe a little bit more valuable.
Yes? Yes? Good girl.
And now lastly, we went with a chew, basically a rawhide chew. And obviously she was much more interested on that.
Yep.
It's a little bit too fast of a progression. You can see she wanted it.
Girl.
With this one, she's a little bit more anxious. She shows a little mounting behavior.
Good girl.
But you'll see with the third and fourth repetition, she's much more relaxed and she's kind of getting it. Okay.
Girl. Give. Good girl.
All right. And then we can you do food bowl exercises. So if dogs showed food bowl aggression, similar exercise, the dog is tethered to a stable point. You train the dog in a novel location where aggression hasn't happened. You use a saucepan with a handle and you work on a threshold where if the dog did lunge and try to show aggression to you, you basically are safe. And if the dog did lunge or show aggression, you may just walk away and avoid it and realize you screwed up. It's not systematic desensitization because you didn't take small enough baby steps where you avoided the practice of undesirable behavior. So let's watch this.
Sit. 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 Sit.
So eventually you can take your hand off of the handle.
Sit.
You cue the dog to sit with offering the food. You cue the dog to sit with taking away the food. You're trying to make the behavior predictable. If the dog can predict what's going to happen next, it's less likely to show aggression.
Sit. Sit.
And then eventually you may toss food into the saucepan while the dog is eating. You can also use a ladle where you use the ladle as an extension of the hand and you add food to the food dish while the dog is eating.
Sit.
All right, let's talk about behavioral medications and get finished up here. Behavioral medications may modify the perception of the environment and they can help the patient to cope with environmental modification. Usually we're going to think about daily medicines. They're important when we can't avoid or identify antecedents that induce the behavior. And daily medications can help to improve social fear and social anxiety. So I'll think about it in those cases, as well as in cases where there are aggression. And during the loading phase of a mainstay medicine, which may take 4 to 6 weeks to build up in the system and actually have effects, sometimes we'll think about situational or anti-anxiety medications. So let's look at these. Especially in cases of aggression, almost in all cases of aggression, especially when avoidance is difficult or not possible, I'm going to think about an SSRI. Generally, an SSRI, a selective serotonin reuptake inhibitor, is the drug of choice for aggression. In cases of food bowl aggression, my medicine of choice is going to be fluoxetine. Fluoxetine is a good anti-anxiety medicine. It has some impulse control effects, and it's more likely than other SSRIs to cause a slight reduction in appetite. That could be beneficial, as well as if the dog is less fearful or less anxious. Then food isn't $1 million to the dog, so it can be beneficial. And so that's my go-to of choice in food-based aggression. With non-food-based aggression, oftentimes I'll consider another SSRI, paroxetine. Paroxetine may have greater anti-panic effects, and it's less likely to cause inappetence. And in my clinical impression, it's less likely to possibly have paradoxical excitation or paradoxical increased irritability in dogs that I sometimes see with fluoxetine. So pros and cons to each, but really you could choose a TCA, tricyclic antidepressant. You could choose an SSRI. It's really not wrong. Lots of different medications you consider for social fear, social anxiety associated with resource guarding behavior. Now, because those medicines don't work right away, and it depends on my clinical patient, sometimes I'll think about while I'm waiting for the loading effect of that SSRI or TCA, I'll use an adjunct medication or a situational event medicine. And that may be gabapentin. Gabapentin is used in people for social anxiety, social fear, and generalized anxiety. It's less likely to cause sedation. And it likely works, or a probable mechanism is by inhibiting glutamate, the major excitatory neurotransmitter in the brain. So it can be beneficial with impulse control too as well. In some select patients, I might think about trazodone. Trazodone is a serotonin antagonist reuptake inhibitor. Clinically has been shown to promote calming in dogs. It's primarily used in people for insomnia. So if I want more of a calming, more of a sedation effect, and usually that's temporary and transient, because with long-term use, it acts as a serotonin reuptake inhibitor and can potentiate the effects of an SSRI, then I'll pick that medication in specific cases. It also depends on other comorbid diagnoses that they have. So if this dog is breed-specific hyperexcitable, and that is driving the owners crazy, maybe trazodone would be a better adjunct to kind of give them some relief where the dog is calm or less anxious all the time and isn't stealing objects off the counters and running away with them or showing aggression with those behaviors. Then we may think about complementary and alternative therapies. So we're going to treat possible stress-related gastrointestinal upset, inflammation, or pain. So there are prescription GI specific diets that are out there. I didn't know about, I learned about, but Blue Buffalo has several prescription GI diets, and they have hydrolyzed diets too as well. So consider a prescription diet if there's dietary sensitivity. A prescription diet may make the dog feel much better, especially if the dog had food allergies or those kind of things that contribute to irritability. Most of my patients, I'm going to recommend Purina Common Care. I don't believe it's been published yet, but in a study, 90% of dogs show a reduction in excessive vocalization, repetitive behavior, cortisol levels went down, and heart rate variability improved. Physiological and behavioral indicators of reduced stress in 90% of dogs after about 6 weeks. So there can be behavioral benefits as an adjunct to conventional medications. And then a lot of my patients, I'll consider an omega-3 fatty acid where I'm using DHA and EPA, the active ingredients at anti-inflammatory dosages. EPA can improve cognition and learning in dogs, or excuse me, DHA can improve cognition and learning in dogs, and EPA is an anti-inflammatory and antioxidant and may have pain relieving properties similar to a non-steroidal anti-inflammatory, as well as an antioxidant good for the skin, good for the coat, good for the vision, good for the gums. So can be health as well as behavioral benefits. When we have mild cases of fear and avoidance, you might consider a nutraceutical or another supplement. I oftentimes will use Zilkine, made by Betoquinol. I'll use Angziatane, made by Verbac. Both of those are extremely palatable, and we might consider using Adaptil, whether we use a plug-in or we use a collar. In one study looking at Adaptil with puppies wearing a collar, we found pretty strong evidence that it improves socialization. So likely it helped with social fear, social avoidance, and puppies were much more confident with Adaptil. So there may be some benefits, but it's going to be lower on my list for behavioral benefits for the cost than our other nutraceuticals, and then those are going to be lower on my list than other conventional medications. All right, so we want to thank Blue Buffalo for bringing this presentation to us. Stephanie, you want to take over?
Thank you so much, Dr. Martin.
Stacey.
That was a great presentation tonight. We all learned so much. So thank you for being with us here today. And thank you to Blue Buffalo for making tonight's presentation possible. And thank you to everybody for joining the webinar. So for those of us who are Fear-Free members, we do have a 20% discount off of your renewal, courtesy of Blue Buffalo. You can use the code BlueRen21. Or if you're interested in becoming a Fear-Free member and you're just registering for the first time, you can get 20% off of your registration using the code FFBlue21. And you can use either of those codes on fearfreepets.com. So now we are going to get to some questions for tonight, and we have quite a few of them come through.
Okay, I'm ready.
One question that came up frequently is, how do you proceed when the owner is the valuable resource that the dogs are guarding?
Yeah, it can be much more challenging if the owner is a resource that the dog is guarding. A lot of times that's been conditioned where the owner picks up the puppy, and they usually are small breed dogs when that happens. And so you have two possible options. One is we think about using classical counter conditioning, where we classically condition the dog to the presence of other people. So we may alter human-animal social interactions where the person that the dog is guarding, we may have that person kind of downplay social interactions with the dog, and then have maybe it's like a husband and wife and say the dog guards the wife. We may have the husband take over some of those responsibilities of social interactions, structuring human-dog interactions, the format of a cue response reward, most social interactions associated with food. And we may have the female owner, the wife, maybe back off on some of those social interactions. So we're establishing a relationship with the other person in the household. And we're making sure that the person who the dog guards isn't developing an alliance, because sometimes that can be alliance aggression. And a lot of times dogs that guard people will guard that dog, not necessarily from other people, but also guard that dog from other pets in the home. And it usually has been inadvertently reinforced, where they pick that dog up. One dog runs over to the other dog, they pick it up, and it's almost like they came to its backup and they reinforce the behavior. And then oftentimes there is some codependence on that owner. So can we lessen the codependence on the owner by changing social interactions with that dog, and then working on other household members to improve trust? So one technique I sometimes use is a technique called engage disengage. And so we may have the female owner who the dog guards has the dog on leash, and the other individual walks in the room, and the handler, the female owner, basically clicks and treats the dog for looking at that person, the husband, let's say. And then the husband walks back out of the room. So a desensitization to approach exercise. The husband walks back in the room. The dog gets a treat for looking at the husband and not growling, barking, or lunging. Husband walks back out of the room. And eventually the husband can walk closer and closer over to the wife without the dog showing aggression. So we're classically conditioning the presence of the husband that good things happen. And then if there can be other times, because a lot of times in these cases when, say, the wife's not around, the dog has no issues with the husband. It doesn't, it's fine with him. It's not showing any social fever, social anxiety, or avoidance. And so there's been a condition component. There's always a condition component. Almost always there's an underlying anxiety component. And so we treat that with behavioral medications or complementing and alternative therapies too as well.
That was such a great answer. Next up, we have a shelter situation where new intakes are showing food aggression, such as when another dog passes by their kennel.
Most of the time, we're going to think about antecedent arrangements in that context. So can we have antecedent arrangements? Can we avoid visualization outside the kennel for the practice of undesirable behavior? So if we can do a visual block on the front where we stop that behavior from happening, at least we're preventing the practice of that behavior. Because if we can't prevent the practice of that behavior, the behavior is going to get worse. So that really comes to environmental modification, prevention management, controlling antecedents there.
All right, here is the next one up. How would you handle resource guarding of water?
Interesting question. Something I didn't have time to go into. I know I went a little bit over. It's a pretty broad topic, and I get a little bit winded sometimes. But oftentimes when I see dogs that guard water, it's because the food dish and the water dish are both side by side. And so the dog associate, and then usually there's a specific location, like the food dish is located right here over in the corner. And then that area, even if the food or the water dish isn't there, can become a high valued resource for the dog, and the dog may guard it from other pets. So in those contexts, we may work on systematic desensitization, where we have a water bowl over here, a water bowl over here, or a food bowl over here, a water bowl over here, depending on if it's food or water. If one dog looks at the other dog, we click and treat. If one dog ignores the other dog, we click and treat. If one dog responds to a known cue, we click and treat. And we work at a distance that the dogs don't show any aggression. And then we gradually reduce that distance between the dogs without ever aggression. So we're teaching them to see each other in the presence of food or water and not show aggression. But a lot of times we'll also consider management. And oftentimes if we can just say, well, give them multiple water bowls, give them multiple water bowls in several different locations in the house, and separate the water dishes from the food bowls. That's really important. We don't want water dishes by food bowls because the food or the smell of food in that area is why dogs oftentimes will guard water. You also could think about medical problems. So does the animal have polyphagia, polyuria? You want to think about medical problems possibly too if the dog's guarding water, like is he excessive water drinker or those kind of things.
Very, very helpful. Someone in the chat said that answer was particularly helpful for a client they're going to see tomorrow. So
okay,
very timely topic for everyone. A question here about cats, not the topic for tonight, but do some of these methodologies work with cats that resource guard food?
Yeah, so it's interesting, do cats really resource guard food or not? Cats really come together and they're sociable dependent on resources. So in the absence of resources in an outdoor environment, they're solitary hunters and they're going to eat multiple small meals frequently. And of course, in the domestic household, we usually feed cats highly digestible food once or twice a day, and it's not like their natural environment. But certainly in cat environments, you think about it, it's a little bit different. We start to think about an environmental plenty. So you think about if each cat can have its own microhabitat and have its own food, water, litter box station, where it's almost like you have your own little room that has a dorm fridge, it has a bathroom, that's your private bathroom. I don't have to come out and see all my roommates, right? I don't have to do those things. And that cats can control their social distance. And then we think about increasing vertical living space, because studies have shown that if cats can use three-dimensional living space, they're less stressed than if not. And it's actually adding territory to the home. So it depends on the size of the home. Like you may not be able to cost to add an addition to the household, but if we can increase environmental enrichment, multiple resources, food, water, litter box stations, three-dimensional living space, you're less likely to have social tension in the household. Yet still, sometimes we need to think about that cats may tolerate each other rather than actually love each other and be cuddly with each other. A lot of times in households of cats, we see passive aggression. There's not always active aggression, but there's oftentimes a lot of passive aggression, stink eye, a dirty look, those kind of things. And some of that can be normal. So we want to try to minimize that. So if it's a mild case, maybe consider nutraceuticals. I use a lot of Zilkine. I use a lot of the Royal Canin Calm diet in cats that have mild social tension. Sometimes I use Feel Away Multicat. There was a placebo-controlled study that showed it may reduce social conflict in cats. And then sometimes we use medications too as well. Usually an SSRI.
All right, next question is about cage aggression in the clinic. Is this a type of resource guarding behavior?
To me, cage aggression for the most part is going to be fight or flight, right? The animal is in a cage. It feels the threat of another dog walking by or a person walking by. And because the dog can't get away, it resorts to aggression. So if it could get away, it probably would show avoidance behavior. If it can't get away, it's likely to be up at the front of the cage and it's going to be barking and growling and lunging at a person or another dog. So for me, that is more of a fear-based type of aggression. And typically how we try to treat it is with classical counter-conditioning. So avoidance, environmental management, can we put visual blocks? Can we put this dog in a kennel where there are not a lot of other dogs, like over in the corner, right? Where not a lot of dogs or people have to walk past it. Can we use visual blocks to reduce fear, anxiety, and stress? And then lastly, it's classical counter conditioning, where anytime a person walks by, they toss a food treat over to the pet. And that's regardless of its behavior, even if it was growling, barking, or lunging. The analogy I could give a person is if every time a mailman walked past your house, or a certain neighbor, let's say, that you didn't care for very much, maybe they were a jerk, and you didn't like them, but if every time they walked past your house, they threw $50 on your doorstep, even if you had a really strong dislike for them, or they threw chocolates on your doorstep or a bunch of roses, whatever is your classical counter conditioner, eventually you might say, hey, I hope that person walks by again, and I'm not going to curse them out, and I'm not going to shout at them, and I hope they pass by my house again. So you will see with classical conditioning alone, you should see a drastic change in behavior, or at least a change in the vocalization of the bark, where it used to be much more strong, much more stoic, a lower intonation, and now it's going to be a little bit more half-hearted. And then there's other things that you can use. There's a lot of technology that could be used. There's a product, smartanimaltraining.com has a pet tutor. It is a remote treat dispenser. You can set it up on a cage. And these are commonly used in shelters and in veterinary hospitals. And so you can, from a distance that doesn't elicit aggression, or when the dog hears footsteps walking down the hallway, you can push a button and it goes beep, and it drops a piece of kibble or it drops a readily consumed food treat into the cage. Can be extremely effective in a shelter environment or in a veterinary environment.
Those are great suggestions, and I'm sure everybody deals with a little bit of cage aggression sometimes.
Yeah, pretty common problem.
Question here. Would you consider a livestock or guardian type dog guarding its flock as a form of resource guarding or work that it's actually bred for?
So livestock guardian dogs have been selected to guard livestock. So it can be a type of protective aggression, right? It can be a normal behavior of livestock guardian dogs, whether they're guarding sheep or whether they're guarding their family members. There probably are some physiological differences, and livestock guardian dogs may actually have lower brain serotonin levels than other breeds of dogs. So it can be a normal behavior that can be problematic. And when I see it as a problem is when people, adopt the livestock guardian dog and they have it with their family and kids. And these dogs oftentimes are territorial. So most of the time for me, they're showing aggression to unfamiliar people off the property. And sometimes they may be showing aggression towards people on a walk with social approach. Right? So their humans may be part of their flock.
So important to keep in mind that some of these breeds have been bred for certain behaviors. All right, let's see here for the next question. All right. Apologize. One question.
No problem.
Here. Is leash reactivity in general a form of resource guarding?
I don't believe so. No, not typically. When I see there's multiple different motivations for leash reactivity in dogs. Sometimes leash reactivity in dogs can be that the dog is just excited and wants to go over and say hi and can't control its arousal, but it's friendly, right? There are other times where leash reactivity could be a fear-based type of aggression, where the dog is afraid or it's frustrated because it's held back on leash. And then there can be times where there's fight or flight, the dog can't get away, it can't control its social approach with meeting another dog. And so it shows aggression in that context out of frustration. And then it depends on the human, the handler, the human-animal social interactions, the previous learning history, the previous training history, because if they use corrections to try to stop the behavior, you're actually classically conditioned a negative emotional state with the site of stimuli. So the dog sees a person, it gets a leash correction, and now it's afraid, it's anxious, it's frustrated, right? Almost like if every time you're on a walk with a neighbor, they pinched you when you saw X, Y, or Z. And so you're going to end up flinching, right? Next time you see it when you walk with that person. So they're fostering a negative emotional state rather than a positive emotional state. And so classical counter conditioning is going to be important, as well as operant counter conditioning.
As we're talking about important definitions, can you define positive punishment?
So positive punishment is the applying of something adversive to decrease the frequency of a behavior. And it has only happened if the behavior decreases in frequency.
All right, here is another question about some of the studies that you referenced. Are those generally done in shelter settings or home environment?
A majority of the studies on food guarding behavior were shelter studies. Some of the studies were surveys. The Guy Lucier studies were actually surveys that were done. A large epidemiological study, I want to say, was 3,200 dogs or surveys. So a large epidemiological study that was done in Canada.
And here is another question. Is there a genetic link, or has there been a genetic link established for resource guarding issues?
We don't know for sure. I mean, when we think about behaviors, again, it's nature or nurture, right? What is it? But it's really a combination of both. Like learning is so important. So hasn't been a definitive genetic link. I can't think of a specific breed per se that I see more commonly to show resource guarding behavior. Although, there is some indication that small breed dogs may be more likely to show resource guarding, but there's a lot of variability. So not a definitive genetic link associated with resource guarding behavior.
That's important as well. And then just trying to be respectful to everybody's time here. We
No, I
will
understand.
wrap it up with just two more questions. One being, one of our viewers noticed that the link in your slide, teameducationandanimalbehavior.com, is broken. Can you verify what that site should be?
That's what it should be. It might have been hacked and it might have come down. And if that's so, that probably happened pretty recently. So that's my sister company, basically Team Education Animal Behavior. So we'll have to check that out. Veterinary behavior is my clinical behavior practice.
All right. And then the last question that we are going to take tonight is, would you mind quickly reviewing the slide with the medication recommendations?
Yeah, sure can. So we can go
We'll
back
leave
to that.
everybody on that note.
All right, so general medication recommendations. So typically a mainstay medication, that's going to be an SSRI or a TCA. So an SSRI is a selective serotonin reuptake inhibitor. A tricyclic antidepressant is a TCA. Generally for aggression, SSRIs have less side effects than TCAs, and SSRIs are the drug of choice for aggression. They're less likely to disinhibit aggression, and low brain serotonin levels have been associated with increased irritability and aggression in multiple species, whether we're talking about companion dogs and cats, zoo animals, or even humans that have irritability or aggression. And so for food-related aggression, I consider fluoxetine, that's generic Prozac. You see the big pill in the bottom, right? That's generic Prozac. The veterinary equivalent would be Reconcile, but that would be extra label use for anything with aggression. And generally, I'll start patients on 0.5 to 1 mg per kg once a day, given with food, not on empty stomach. If you give it on empty stomach, you're more likely to have stomach upset. And after 4 to 6 weeks, I'm going to bump them up to that dosage range. When you do a slow weaning up protocol that way, you're less likely to have side effects, but you can see a temporary transient reduction in appetite and a temporary transient possible lethargy with it. When we taper them up slowly, you're less likely to see side effects. But because fluoxetine is more likely than other SSRIs to have transient reduction in appetite, it may actually be beneficial and reducing the value of food for dogs that resource guard food. So that's why that's my medicine of choice, and that's the one I most commonly use for food-related aggression. For non-food related aggression and for other behavioral problems, a lot of times I'll choose a different SSRI. Paroxetine is the generic of Paxil. It's used for social anxiety disorder, social fears, panic attacks, but also for irritability, impulse control, and I sometimes see less side effects with paroxetine clinically than I see with fluoxetine, and it's really the same dosage range. We dose it the same. SSRIs for the most part, almost all are going to be about 1 to 2 mg per kg once a day given with food. It's not, and so those are aggression cases. It's not wrong to consider any other anti-anxiety mainstay medicine, a tricyclic antidepressant, SSRI for dogs that show social fear or social anxiety. And it depends on if it's significant. Mild cases, we may not use conventional medicines, but much more significant cases where there's certain social fear or anxiety, maybe generalized anxiety, also have separation anxiety, also show excessive attention-seeking behaviors and stealing objects, and it's problematic for the owner. We're going to have better success when we start a mainstay medication, but that medicine doesn't work until about 4 to 6 weeks. So what do we do in the meantime? How can we give the client help, and how can, first and foremost, improve the dog's welfare while we're waiting for that medication to kick in? Typically, I'll think about an adjunct or situational event medicine because those medicines usually work right away. You're usually going to get some benefits right away. And gabapentin I consider for social fears, generalized anxiety, least likely to be sedating, has some chronic pain relieving properties. We start at a low dose, typically start 2 to 3 times a day. Unlikely to see side effects. There's a 6-fold dosage range. Yeah, at fear-free dosages, as a pre-veterinary visit pharmaceutical, you're more likely to have sedation or wobbliness. Most dogs starting at 10 milligrams per kilogram twice a day, well tolerated, you don't see any side effects. But rarely you can see paradoxical reactions where you can see increased anxiety. So we start one thing at a time and we assess. We don't start 2 medicines at the same time because if something went wrong, you don't know what medication it was. And then depending on my cases, I might consider trazodone. Trazodone is used for insomnia. It's a serotonin antagonist reuptake inhibitor, especially with the repeated dosages. But there are many studies that show that trazodone has behavioral calming properties. And so it may make dogs a little bit sleepier, a little bit calmer. Sometimes that's beneficial. Sometimes that's undesirable for patients. So I select that for specific patients that are more likely to be hyperexcitable. They have generalized anxiety. Maybe they have separation anxiety and they're showing excessive vocalization. So when there's an arousal condition, I usually think, and that arousal condition is problematic for the owner, I might think about using trazodone. But in a lot of my patients, I don't want to sedate them. I just want to address the underlying anxiety. And so most of my patients, I'm going to consider gabapentin as a initial adjunct medication, start them on gabapentin, assess the behavior over a week, make sure the dog isn't any worse, and then layer on an SSRI. And conversely, sometimes you might start trazodone for a week, but rarely, and I think the biggest common mistake veterinarians make is that they pick an adjunct medication and they try to treat behavior problems with just a situational event medicine, a PRN medicine, just given as needed. And they don't use a mainstay medicine. That's one common mistake veterinarians generally make. The other common mistake they make is they prescribe medications and don't do concurrent behavioral or environmental modification. And it really depends on what behavioral modification that they do, because some things that we do with training actually can make the behavior much worse. Some things we can do with training make the behavior much better. So I'm assuming you're talking about the conventional medications as opposed to the complementary and alternative medications or therapies.
Actually, we did have somebody ask about the link between probiotics. So if you wouldn't mind just explaining how that supports behavioral health, and we'll take that as the last question.
Yeah, so probiotics, there's a brain-gut connection. It's been well studied in animals as well as in people. People who suffer from depression or anxiety, there are studies that looked at fecal microbiome transplants where they take the gut bacteria of a non-anxious person and put in an anxious person or a depressed person, and people have reported like dramatic changes right away. They've looked at studies in rodents, and they had anxious models of rats and non-anxious or healthy model rats. They took their gut bacteria and the anxious rats and they put it in the healthy rats, and they made the healthy rats anxious. They took the healthy gut bacteria and they put in the anxious rats, and they made the anxious rats non-anxious. Okay, so there's multiple studies that probiotics may have an anti-anxiety effect. There was actually a medical student study prior to taking examinations, and they were on a probiotic or placebo, and the ones that took the probiotic actually showed less anxiety. So you have more serotonin receptors in your GI tract than you actually have in your brain. And all your dietary proteins are made from, or your neurotransmitters are made from dietary proteins. And it's your gut bacteria that helps with the uptake of those proteins and the conversion over into your neurotransmitters. So healthy gut bacteria and healthy gut flora can influence neurotransmitters levels. It was studied in dogs. We have 90% of dogs after 6 weeks on it, 1 packet sprinkled in the food once a day with Purina Common Care. Again, a reduction in excessive vocalization, repetitive behavior. They were Labradors. Reduction in cortisol levels, indicator of reduced stress, and heart rate variability improved, another indicator of reduced stress. So there's physiological as well as behavioral indicators of reduced stress with given a probiotic. And multiple patients that have anxiety-related conditions have chronic GI upset. You know, or you think about inflammatory bowel disease. Inflammatory bowel disease is oftentimes associated with anxiety in people too as well. And so an upset stomach or a dietary sensitivity is likely to cause some frustration and some anxiety. You know, like if you're feeling a little bit nauseated, but right before you're feeling a little bit nauseated, maybe you think you're hungry, right? You feel hungry and then you're like, oh no, I'm sick. And some dogs likely feel that way too as well. So we want to address gastrointestinal upset or dietary sensitivity or a food sensitivity that may contribute to behavioral problems. And, you know, I'm hungry, but now I feel sick after eating the food, and now I'm cranky. And so there's a classically conditioned association that's happening. I eat the food, it makes me feel sick, or it makes me feel cranky, or it makes me feel agitated, or, you know, more itchy, essentially. And so those can contribute to behavioral problems.
What a great note to wrap it up on tonight. So thank you everybody for sticking it out with us. I know we went really long this evening, but we're so happy to have you with us. Thank you again, Dr. Martin, and thank you to Blue Buffalo for making tonight's presentation possible. I hope everybody has a great day. And Dr. Martin, we had several people chat through condolences for Ileana. So we do send you with our sympathies for your loss.
Thank you, everybody. Yeah, she was my baby. I'm going to miss her always.
Well, thank you again, Ken, and we will see you soon.
Sounds good. Everybody have a wonderful night. Nice talking to you.
Good night, everyone. Take care.
Good night. Bye-bye.